Let's now talk about the physical fundamentals of the therapeutic laser. When electromagnetic radiation, such as laser light, comes into contact with biological tissue, four physical phenomena can occur: reflection, scattering, absorption, and transmission. In clinical practice, the most important phenomenon is absorption, as it allows the light to be captured by cellular structures such as mitochondria, thus initiating the therapeutic effects of photobiomodulation. A portion of the light can be reflected off the skin and not penetrate, another part is scattered in multiple directions within the tissue, and a fraction manages to be transmitted in depth. However, only the light that is absorbed generates a biological response, stimulates ATP production, reduces inflammation, promotes tissue regeneration, and improves microcirculation. Therefore, understanding this interaction between light and tissue is essential to optimize the treatment and enhance the clinical efficacy of therapeutic laser. If we look at the therapeutic window of penetration according to the wavelength, we realize that wavelengths between 800 and 1000 are considered optimal for treatments in physiotherapy, because they allow greater penetration into the tissue, thus reaching deeper structures such as muscles, tendons, joints, and even nerves. In contrast, shorter wavelengths, between 400 and 700 nanometers, are mainly absorbed in the superficial layers of the skin, making them useful for treating skin lesions or very localized inflammations. In the graph, you can observe how different components of the body, chromophores such as water, oxyhemoglobin, cytochrome C, and melanin absorb light depending on their wavelength. The therapeutic window, therefore, is marked in blue and represents the range in which light can penetrate effectively without being excessively absorbed by the surface or being differently scattered. Thus, correctly choosing the wavelength allows the treatment to be adapted to the depth and type of injured tissue, thereby maximizing the clinical efficacy of laser therapy.